name's Hodgson and I'm the director of the Hallamshire Physiotherapy Clinic in Broomhill in Sheffield. Today I'm going to talk to you a little bit about multiple sclerosis, or MS as it's commonly known, and discuss with you the effects that physiotherapy and exercise can have with MS and the benefits that you may find from that. Multiple sclerosis, or MS, is an autoimmune disease that affects the nervous system, and currently there's around 100,000 people in the UK with MS and suffering from the consequences of having such a disease. It's the largest single cause of young adult disability in the UK currently, and so there's a lot of time and effort being placed on looking for cures for MS and also looking for ways to help the signs and symptoms. Many of the signs and symptoms can be quite debilitating. We're looking at loss of movement, loss of sensation, balance issues, walking problems, sleeping problems, the ability to actually move around and function within society. It can also affect your eyesight, it can affect your ability to interact through speech, etc. There are many different types of MS. Four common ones are benign, relapsing remitting, primary progressive and secondary progressive. And all of these can vary in severity. It can affect people in many different ways. So the fact that you have MS does not mean that you're going to end up in a wheelchair. There are many people walking around the UK with MS rather than sitting in wheelchairs. However, it is a progressive disease, and so therefore it needs to be managed as such. Many of the symptoms, as I've described, are drug managed, so the consultant or the GP will put you on a regime of different medications to help with the signs and symptoms. But physiotherapy is another way that these signs and symptoms can be helped. So physios can help with balance problems, gait problems, strength of muscles, stiffness in muscles. It can also help in the way it can affect your mood, so physiotherapy can help with that, and it can also tailor advice and education to the way that you need to manage your life. One of the main issues that some patients describe is fatigue, and severe fatigue, not just tiredness but fatigue within your muscles. And there used to be a school of thought that exercise would make that worse. Actually, there's no evidence to suggest that. In fact, exercise can help with fatigue if it's tailored exercise. So you should be talking to a physiotherapist about what sort of exercise is beneficial for you. Exercise doesn't have to be running on a treadmill. Exercise can be seated exercise. It can be exercise lying down. It can be exercises just in gentle standing. So there's many different forms of exercise, and it will help with strengthening. It will help with your ability to control your weight if you're spending a lot of time sitting. It can also help in terms of strengthening bones if you can get some weight bearing through those. So exercise is a very key aspect to managing MS these days. And again, a physiotherapist can help you tailor that form of exercise to what's going to be most appropriate for you. Exercises such as Tai Chi and yoga, Pilates, those sorts of exercise can also be beneficial if you're unable to do other forms of exercise. They're very good for balance, for control of your muscles, and also again for helping your mood and helping you to control your disease process. Physiotherapy will take the form of an assessment usually, so a patient will be assessed first, and we will look at all the aspects of how MS is affecting your life. We'll look at the symptoms that you've got, and we'll look at how we can best help you manage those symptoms. Physiotherapy is usually hands-on physiotherapy. There's very few bits of equipment or electrotherapy that will be used, but it will be hands-on physiotherapy looking at how you move and helping you to optimise the movement patterns that you've got. Once you've had an initial assessment, goals will be set, and there'll be realistic goals to help you decide on how best you and the physiotherapist can manage that condition. Treatment with physiotherapy is usually aimed at lots of work around strengthening, balance and function. Function being the key, looking at the aspects that you want to work on within your life, what you want to function, how you want to function, and how we can help you to maintain that for as long as possible, or in some cases following relapse, improve it. The best thing you can do is get advice from a neurophysiotherapist about the way forward for you and for your MS. If you'd like to know more about it, please contact the clinic on www.hallamshirephysiotherapy.com, look at our website, look at the evidence, and then discuss it with one of the physiotherapists. There can be lots done for people with MS. It doesn't have to mean that MS can rule your life. You can actually change some of the things that you do. Contact us. Thank you.